Let me just begin with a very brief background. Most of you know it, of the Jeffrey Modell Foundation. We started our organization in 1987 in memory of our son Jeffrey. He lost his battle with one of the primary immunodeficiency diseases. He was 15 years old at the time, and he got a very bad pneumocystis pneumonia that he couldn't fight off. For the past 24 years, we have been dedicated in the foundation to reaching earliest possible diagnosis, meaningful treatments, and ultimately cures of the ever-increasing primary immunodeficiency diseases, which, to make it simple for this little talk, we'll call it PI, and that's what they call it at the NIH and in the Congress, so primary immunodeficiency is known there as PI. The way we do this is through a commitment of funding for research, physician education, patient support, awareness, and advocacy. And what we try to do is do each of those somewhat evenly. We are not exclusively a research group or a patient group or an educational group or a political group. We try to do each of those somewhat evenly. Now, a little history. In 2001, the U.S. Centers for Disease Control and Prevention held a consensus conference and concluded that primary immunodeficiency is a serious public health threat. We were hoping they would say it was a concern, but they went beyond and said it was a threat. They talked about, particularly the children, being a delivery system of infection, of virus and bacteria and fungus and other infections to nurseries and to schools, and that it was a public health threat. They recommended a scientific framework to advance physician education and public awareness of PI. 5 years ago, we created, with strong congressional support, a response to that CDC recommendation by establishing a physician education and awareness campaign for these diseases. Now, by every measure, this campaign has been a great success. The number of patients referred, diagnosed, and treated has more than doubled every year for the past 5 years. The number of severe infections, physician and emergency room visits, pneumonias, school days missed, work days missed, days in the hospital, all of those measurements have decreased by 70% or more. And as we spoke about, we took those numbers and we put that on, we took public information on websites, and very conservatively, the difference between a diagnosed patient who is being properly treated and an undiagnosed patient who just wallows in infections over and over again and hospitalizations, the difference in cost is $80,000 per year per patient. This is a huge waste of healthcare resources. We also, as we just mentioned, initiated and funded newborn screening for severe combined immunodeficiency. And as I mentioned, we had a meeting in late January in Washington, and the U.S. Secretary of Health added SCID to the core panel of conditions that are screened for. There were 29 conditions on that core panel, and now, as of January 30th, there are 30 recommended by the Secretary. Newborns have already been screened, have already been cured of this life-threatening disease, and all of this data, our data on the awareness campaign and on the screening, has been peer-reviewed and published in scientific journals. So the data is solid. Now, I say all of this to you not because of what we've done in the U.S., but what can be done here, simply replicating what we've done. We took this program throughout other parts of the world, spanning communities from Texas to Tokyo, from Sao Paulo to Shanghai, from Milwaukee to Morocco, and all that's in between. The Jeffrey Modell Network now has 430 expert physicians at 172 referral centers in 53 countries and on 6 continents. Those centers have reported back to us on the patient base that they follow, and there are now more than 42,000 patients worldwide with a PI disease, we know the specific defect that those 42,000 patients have, where they are being treated, who is treating them, and how they are being treated. We have that data. That data is very valuable and can be used throughout this network. In 2004, we were privileged to participate in the STOA workshop here at the European Parliament. In 2006, the follow-up consensus conference by the European Commission was held in Langen, Germany, and we participated in that as well. And in 2008, a debate was held in the European Parliament on rare plasma protein disorders addressing these diseases. Now, these activities raised awareness at the EU level, but a more targeted, long-lasting initiative that will measurably impact on patient lives, that is what is needed, and that is what is needed now. There are, among our network, 68 Jeffrey Modell Diagnostic Research and Referral Centers in Europe. They are in place. They are headed by experts. Now is the time that we can go forward with a robust awareness campaign to respond to patients in Europe, in Western Europe and in Central and in Eastern Europe. We seek no funding. We ask only for the leadership of this institution to encourage and support EU member state governments to implement campaigns to increase recognition among parents, teachers, nurses, physicians, and researchers. We need to work together with medical specialists organizations to provide standards for training, for teaching, for networking. We need to encourage and support the member states to develop clinical protocols to reliably identify all forms of the disease. We need to encourage interaction between the specialized centers already established in Europe so that best practices in diagnosis and treatment can be developed and implemented in every country. We need to encourage national health authorities to consider PI when developing their national rare disease plans. We need to concentrate with concrete actions to address timely and precise diagnosis, access to safe and effective treatment, and disparities of care. The purpose of today's event is to sign and endorse the primary immunodeficiencies call to action. In the context of the recently adopted Council recommendation in the field of rare diseases and the creation of the European Union Committee of Experts on Rare Diseases, we want to ensure that primary immunodeficiency diseases are recognized and addressed. Now, all of us in this room know that signing on to this document is not only the right thing to do, it is the smart thing to do. And in this case, the word SMART is the perfect acronym that reflects the essential components that will assure our success. The word SMART: specific, measurable, achievable, realistic, timely. Those pieces are in place. This program is a program that works, and this is our moment. We have the model. It is working all over the world. It is a program dedicated to disease prevention that will improve patients' quality of life and control health care costs. Let's think about this together. Tomorrow, more than 20,000 newborn babies will come into this world just in Europe. What kind of life will they have? Will they be healthy? And if they are not, will their parents and their doctors know what to do for them, what to do to help them have a good chance at a good life? Your decision today will provide the comfort and the hope to those new mothers and fathers who will not have to endure the uncertainties, or even worse, the tragic loss of a child to one of these diseases. Vicki and I accept the reality that science and discovery did not come in time to save Jeffrey. But we are dedicated and passionately committed to working with you to help all of the Jeffreys in the future. This is our wish. This is our hope. This is our dream. Let us go forward on this journey together, beginning today. Thank you. Thank you. Now, with Professor Schmidt, we can open the floor for questions and discussions. And clearly, we are urging everyone in the room and their colleagues. Now, that goes for the members and for the physicians. We need both to sign on to our call to action. I believe, and I think you're going to agree, this day will be marked as a historic day for patients not only in Europe, but all over the world. So we urge you to sign on.